Hi everyone, my name's Dr. Mark Ettensohn. Welcome to Heal NPD. A common misconception about NPD is that people with the disorder never seek treatment. An even stranger and perhaps more insidious myth is that by simply asking whether or not you have NPD, you've somehow proven that you don't have NPD. These ideas circulate widely in online discussions about narcissism, reinforcing harmful stereotypes and ultimately discouraging people who actually want help from seeking it. So today I want to break down where these misconceptions come from, why they persist, and how they distort our understanding of NPD. Much of the confusion seems to stem from the fact that many, but certainly not all, people with personality disorders struggle with insight about their condition. Personality disorders affect multiple aspects of a person's life, from relationships to occupational functioning to their own internal experiences. Typically, these patterns of thinking and behaving are both inflexible and maladaptive, yet they may feel entirely normal to the individual. For example, someone with paranoid personality disorder may perceive the world in terms of safety and danger, and their relationships through a lens of humiliation and rejection. Likewise, someone with NPD might view life as a zero-sum game, where a person is either superior or inferior. Their relationships often involve around feeling validated and admired versus feeling devalued and ashamed, and their sense of self often fluctuates between periods of grandiosity and periods of worthlessness, often without much awareness that these shifts are driven by internal processes rather than external events. So given this, it's understandable why some people might assume that individuals with NPD would never recognize these patterns, let alone seek treatment for them. But while it's common for individuals with personality disorders to lack insight, it's by no means universal. Over the years, I've worked with many people with personality disorders, NPD included, who do recognize that their thoughts are maladaptive. But recognizing a problem doesn't automatically mean having the tools to fix it. The reality is that someone can be fully aware that their patterns are unhealthy and still unable to change them. A related concept involves egosyntonic versus egodystonic symptoms, which is an important distinction that's often overlooked. Egosyntonic symptoms feel consistent with a person's sense of self. They don't feel like a problem. A person with NPD may recognize that they experience extreme fluctuations in their self-esteem, but they might believe that the problem is actually in other people for failing to see them correctly, for not offering enough admiration, or for not treating them with the recognition that they feel they deserve. In contrast, egodystonic symptoms often feel alien and distressing. Classic examples might include depression and anxiety, where the person recognizes that something is wrong inside and they seek treatment to change it. The DSM description of NPD heavily emphasizes its egosyntonic aspects, like grandiosity, entitlement, and arrogance, which has led many to assume that NPD is entirely egosyntonic. But anyone familiar with the disorder knows that's simply not true. One of the defining features of NPD is periodic self-esteem collapse. People with NPD do not exist in a constant state of egosyntonic grandiosity. When grandiosity fails, when they experience rejection, failure, or a significant narcissistic injury, they often collapse into egodystonic symptoms like depression, anxiety, feelings of worthlessness and inferiority, attachment anxiety, substance abuse, and even suicidal ideation. It's in these states that people with NPD are most likely to seek therapy. The problem is that clinicians are rarely trained to recognize NPD when someone presents in an egodystonic, collapsed state. Instead, such individuals are often misdiagnosed with major depression, BPD, or generalized anxiety disorder, which reinforces the false narrative that narcissists never seek therapy. As a specialist working in this area of practice, I receive emails every single day from people around the world who recognize that something is wrong and who want help. A significant portion of my practice involves conducting comprehensive personality assessments. And as I've said before, most of the time when someone contacts me suspecting that they have NPD, they're correct. Contrary to popular belief, people can be quite good at recognizing their own pathological narcissism. So the idea that merely asking if you have NPD somehow means that you don't have NPD is an absolute falsehood. At its core, I think this particular misconception rests on a heavily stigmatized stereotype of NPD, one that excludes the possibility of insight or good faith attempts at self-improvement. If we define NPD as a disorder in which a person is incapable of acting in good faith, incapable of caring about others, and incapable of self-reflection, then of course it follows that such a person would never seek treatment or be curious about their condition. This is unfortunately the version of NPD that often dominates online discourse. According to much of the internet, narcissists are purely manipulative, completely devoid of empathy, malicious, and predatory by nature. Do some individuals fit this caricature? Sure. But it doesn't capture what NPD actually is. The research and clinical literature define NPD as a disorder of self-image and self-esteem regulation. While some people with NPD exhibit manipulative or exploitative behaviors, those are not the core features of the disorder. The core issue is an unstable self-image accompanied by at least occasional feelings of grandiosity. When we move away from stereotypes and look at what NPD actually is, it becomes clear why people with the disorder do often seek treatment. Most cases of NPD involve periodic self-esteem collapse. The rare exceptions are individuals with comorbid psychopathy or antisocial traits. But for the vast majority, self-esteem collapses are inevitable, and when they happen, they often seek help. The problem is that the online space is flooded with low-quality, overgeneralized information about NPD. Many of these sources are not based on peer-reviewed research or clinical expertise, take advantage of traumatized individuals by providing easy but scandalizing explanations, and promote armchair diagnosing and sensationalized narratives. If I didn't know what I know about NPD, and I relied only on what I saw online, I too might believe that narcissists are evil, have black eyes, and are incapable of good faith or growth. But this is not what the actual research or clinical literature says. I recently attended an online conference at Harvard, where some of the world's top researchers and clinicians in NPD presented their work. None of them was an advocate for the DSM's outdated model. Multiple presenters discussed the damaging myths and stereotypes that have proliferated online. Their work largely aligned with the material that I present on this channel, and I was reassured to see that my content reflects the most current understanding of this disorder. So if you're here, it means that you're interested in understanding NPD beyond convenient stereotypes. And if you suspect that you may have pathological narcissism, then I encourage you to take that suspicion seriously. It does not mean that you don't have NPD. That's the bad news. But the good news is that NPD is not the monstrous affliction you may have been led to believe. It's a mental disorder, like any other, and it's one that can be understood, worked through, and treated. Okay, so that's it for today. Weekly Insights is a series for paid subscribers of this channel, and if you found this helpful and you'd like to have access to videos like this on a weekly basis, please consider becoming a paid subscriber. There's a link in the description. And until next time, take good care.